Hey everyone, and welcome back to my channel. If you've never been here before, my name is Juliet Tony, and I am excited to talk to you about all things health IT. And in this video, I'm going to be focusing in on those that are nervous and not really sure where to start when it comes to taking their RHIT and or their RHIA exam. So if you are one of these people, keep on watching. This video is for you. So the steps to actually take your exam can seem very confusing, especially when you are really needing to take this exam for more money, for your family, or just to boost your resume. But it's very simple, and we're going to walk through it right now. So step one is going to be first making sure that you qualify to take the RHIT and or the RHIA exam. And the best way to be sure that you qualify is to check out the requirements. So I'm going to share my screen now and show you guys where to go to check to see if you actually qualify to take this exam. So I'm going to share my screen with you, and you can follow along on your own screen at your own time. But what you're going to do is you're going to simply check out the AHIMA website, because they're the ones that actually are responsible for organizing this entire exam. This is their certification. So this is the home website. I'm going to head over to certification. I'm going to go to AHIMA certifications. And when I click on that, you're going to see all of the certs that they have available. So even if you were doing a different certification, whatever one that's on the screen that you want to take, you're going to click on it to learn more about it. So for the sake of this video, I'm going to stick to the RHIA. So I'm going to click here, and it's going to load all the information about it. And it says right here, who should prepare for this exam? So if you want to take this exam, then this description should define you as a person. Someone who wants to manage people, an operational unit, someone that wants to take part in administrative committees. They want to help with budgets. Those that are known to or would like to be able to interact with different levels of the organization. This will also be a good certification for someone that manages patient health information and medical records, administers computer information systems, collects and analyzes patient data, and uses classification systems and medical terminologies. If that's you and that's what you are either striving to do or what you're currently doing right now, but don't have the certification, then this is a winner, all right? So let's talk more about the eligibility. So right here, step one, it shows you what you need to have to be eligible to take this exam. And it's very clear. AHIMA only accepts HIM degree programs for this certification. And this is the area right here that I want to highlight, because a lot of people get egg on their face because they just missed this part. So I don't want you guys to miss this. You have to have or had completed a bachelor degree from an HIM program that was accredited by CAPM. If your school was not accredited by, unfortunately, you would not qualify to take that exam. And there are a lot of universities that offer HIM degrees, but they're not accredited. So just check that out before you start this process. Not only a bachelor's, or some folks that earn their master's, and that was my experience. I earned my master's degree and then got my RHIA right after. So for those that are similar to me, if you have a master's level academic degree from a accredited CAPM school, you can also qualify. And there also are some certs that they have approved that would allow you to take this exam. If you're not sure about whether or not your school is actually on this list, AHIMA was very nice, and they even provided a link that you can click on to confirm if your school actually fit. And if you're still not sure, call the school, speak to your program director, someone, your institution, and they'll tell you whether or not you actually qualified for this cert or not. So that's step one. Please make sure that you check and you're sure that you qualify. So you've done that step, you qualify. Okay, Juliet, what is next? Step two is going to be about taking an actual RHIA or RHIT exam. This is going to be where you're going to be answering questions and seeing just how well you do. You can choose to take parts of the exam or take the entire exam. My personal opinion is that you take a full length exam to get the real experience of what you are trying to prepare yourself for. Okay. You may want to time yourself. I recommend students timing themselves to see how they feel. Does their heart race more? What type of thoughts are they thinking about as they're actually taking the exam? It just really gives you a good idea of what you need to work on, not just concept wise, but also just in terms of your test taking anxiety. So always take a assessment first. Once you get your results, you're going to look it over and you're going to say, okay, I did really well in domain 2 and 5. I did really bad in domain 1. I did okay in domain 4. You're going to assess how well you did. Now that you've done that, you're going to move on to step number 3. Step number 3 is going to be picking a date. One of the worst mistakes you can make is deciding to just study for your exam without having a set date that you've actually paid for and told Pearson that I'm going to come and sit down on this date to take my exam. The reason why is when you don't set that date, you don't have anything to really work towards. You take things a lot more seriously when you have paid money and you have set aside a specific date and time to take the exam. So if you're truly serious about it, set a test date first. Now, how do you pick a test date? Great question. I'm reading your minds. The best way to set your actual test date is going to be based off of your assessment results. How much work do you really need to do to prepare yourself? How well did you do? If you got maybe 30 or 40%, you may want to take 2 to 3 months to prepare. Maybe you got 70% right, and you probably only need about a month to cover up on the things that you need to learn. Everybody has their own allotted time that they're going to need. So there is no perfect study schedule of how long you should study before taking your exam. That's going to be a individual decision for each person. As long as you are studying based on where you are, then that is what should work best. So my recommendation is look at how you did on your exam, and from there, be honest with yourself and gauge how long it will take you to fully understand that information and be able to sit for an exam. And when you're making that decision, think about your life, think about your family, your husband, your wife, your job, your other responsibilities out there, and put that into consideration as you are planning to take this exam. Don't turn into a robot, right? And try to live this super rigid life because you want to take this exam. I want you guys to still be able to breathe and still be able to be human beings and take care of your families and live, your life and do your jobs and things like that. So just be realistic. Yes, be serious, but be realistic. Okay. Would be my advice there. So now we have picked a date. Let's just pretend that we're going to spend 2 months to study. Okay. 2 months to study. I'm going to contact AHIMA, I'm going to register, I'm going to go through Pearson, I'm going to get my authorization to test, and I now have a test date in mind. That is awesome. Now we're going to make that study schedule. And to make that study schedule, you're going to have to, once again, think about your everyday life. What are the things that you need to do? Do you have children that need to go to soccer practice? Do you have a big family and every Sunday you guys meet? All of these individual things have to be considered as you're making your schedules. Once again, there is no one way to do this. Everyone's life is different. So I don't want you guys thinking that you have to have this strict, rigid schedule that may or may not fit your lifestyle. Make sure it fits your lifestyle. Some people study only on weekends. They may study Saturdays and Sundays because during the week they don't have any time. Some folks may study every other day, right? So as long as you're studying enough to get the information that is important for you to master, to pass the exam, that is really what this is all about. So write out your schedule for a week or for your next few months in my scenario. And from there, find those times that work. And then think, calculate, and total up how much time that would give you. And then from there, make sure that you use that time wisely. Okay. So we've now know that we're eligible. We have assessed where we are. We have, from that assessment, determined how much time we need to take to study, honestly assessing ourselves, right? We've now contacted AHIMA. We have also contacted Pearson to actually book our seats. We have an actual test date in view, in mind. And now we have a study schedule. Now it's time to study, right? So as you're studying for your exam, remember this is not a memorization exam. It's not about memorizing answers. They want you to understand concepts. So as you are studying for your exam, please keep that in mind. Now, there are a lot of study tools out there that you can use, and they're all great. I don't have anything negative to say about any of them. Obviously, you guys know this, but regardless of what you end up using, all of our goals for every test provider out there is that the reader understands the concepts. As long as you're using something that is going to help you understand the concepts, then you're going to win. Okay. Once you've mastered those concepts, that should be your focus. So as you're going through domain to domain, you're going to make sure that you are able to not only understand the concept and the knowledge behind it, but also being able to answer questions. So practice questions are going to really be the only way to know whether or not you fully understand something. AHIMA has a great book that every single person watching this video should have that will provide you with practice questions that you can use as you're preparing for your exam. You should be utilizing that book as you are studying each domain. How do you pick which domain to pick first? My recommendation is you are going to start off with the domain that you did the worst at during your assessment that requires the most improvement. Start there, get through that tough time of trying to get that information, and then from there, trickle down. You should study every domain. You did great in domain 2. That's lovely. It doesn't mean that you know everything in domain 2. Just answer those questions right. You may not know something else that could be testable. So please treat every domain equally, even though you may have shined during your assessment in a specific domain. That's a big mistake that people make. I know this, and then they get there and they fail because they didn't take the time to study a specific domain because they were too confident about their ability in that domain. So please take every domain seriously and treat them equally. Okay. Know your weaknesses, but still treat them equally. So we're going through domain, right? We are getting through all of the different concepts. We're answering questions, getting them wrong, finding out why we got them wrong, using our study materials. And from there, you're going to continue to do that. And as you're studying and you're doing more questions, you should be doing better. Okay. You should be doing a whole lot better. And as you're doing that and you're getting closer to your actual day of the exam, that is when you want to find 2 days, I say 2 days, where you would take a full exam in a test environment. By test environment, a place where no one's going to walk in and interrupt you, a place where you won't have a lot of noise and just a lot of distraction, and you'll be able to take the exam like you were really a Pearson testing center. The perfect place to do that is the library. They have quiet rooms in every single library that I've ever seen, and you could request a room for that time, put on your timer for whatever exam that you're taking, and test and see how well you do in that time. Remembering, am I breathing properly? Am I having negative thoughts in my head as I'm answering these questions? Am I going blank as I'm taking these questions? All of these things are gonna happen to you not when you're studying independently on your own, but when you put that pressure on yourself and you have a timer. And that's the reason why I want you guys to time yourself for that first assessment. So you're going to do this twice. Take 2 full exams, not on the same day, please, on different days. Take a full length exam, time yourself, and then once again, see how you do. Whatever questions you get wrong, it's totally fine. Review them, read up on them, make sure that you understand the concept of why you got that question wrong. And you're, believe it or not, building yourself up to be more prepared and stronger for testing. And then obviously you go out and you take the exam. Now, there is something or some details that I have not added to this video. And you're probably wondering, okay, you said all these great things to me, Juliet, but what are the resources that I should be using? Where do I find all these test questions? You're saying that all the books are the same. So, what do you actually recommend? In my next video, I'm going to walk through what I would recommend. Thank you for watching once again and have a great day. Bye, everyone.